Have you ever wondered if your body might be trying to tell you something important about your heart health? Sometimes, our bodies give us subtle clues that can indicate a potential risk of heart disease. It's crucial to pay attention to these signs, as early detection and prevention can make a significant difference. Here are 8 signs that your body might be telling you that you could have a heart disease risk. Number 1. Chest pain. Have you ever felt an uncomfortable sensation in your chest and wondered if it might be something serious? Chest pain is one of the most common signs of potential heart issues, and it's essential to understand what it might mean. The key thing to note is how and when this pain occurs. If you experience chest pain during physical activity or when you're stressed, and it eases with rest, it could be a sign of angina. Angina happens when your heart muscle doesn't get enough oxygen-rich blood, often due to narrowed or blocked coronary arteries. Another critical aspect to consider is the duration and pattern of the pain. If the pain is brief and sharp, lasting just a few seconds, it might not be related to your heart. However, if it lasts longer than a few minutes, or it goes away and comes back, it's something to pay attention to. Persistent pain that doesn't go away with rest, especially if it's accompanied by other symptoms like shortness of breath, sweating, nausea, or lightheadedness, can be a sign of a heart attack. If you have risk factors for heart disease, such as high blood pressure, high cholesterol, diabetes, smoking, a family history of heart disease, or if you're overweight, chest pain should be taken seriously. These factors increase your likelihood of having heart-related issues, making it crucial to monitor any chest discomfort closely. But keep in mind that not all chest pain is related to the heart. It could be due to other conditions like acid reflux, muscle strain, or lung issues. However, differentiating between these causes can be challenging without medical help. Number 2. Trouble breathing. When you experience trouble breathing, it can be a sign that your heart isn't working as it should. Your heart and lungs work together to supply oxygen to your body. If your heart isn't pumping efficiently, your lungs might not be getting the blood flow they need, leading to shortness of breath. One key point to watch for is how easily you get winded. If you notice that you're getting out of breath doing activities that used to be easy, like climbing stairs or walking short distances, this could be a red flag. This change in your ability to breathe comfortably can signal that your heart is struggling to pump blood effectively. Another important aspect is when you experience this shortness of breath. If it happens when you're lying down or at rest, it could indicate heart failure. When the heart can't keep up with the body's demands, fluid can build up in the lungs, making it hard to breathe, especially when you're lying flat. This is known as orthopnea. Pay attention to whether you wake up at night feeling short of breath. This is called paroxysmal nocturnal dyspnea. It's a specific symptom where you suddenly wake up gasping for air, which can be quite alarming. This happens because fluid that has accumulated in your lungs while you're lying down redistributes when you lie flat, making it difficult to breathe. Number 3. Ankle swelling. Ankle swelling, also known as edema, can be a sign that something is wrong with your heart. When your heart isn't pumping blood effectively, blood can back up in your veins and cause fluid to leak into surrounding tissues, leading to swelling. One key point to note is the location of the swelling. If you notice swelling in your ankles, feet, or legs, it could be linked to heart problems. This type of swelling often starts in the lower extremities because gravity causes fluid to accumulate there, especially after you've been standing or sitting for a long time. Another important aspect is the pattern of the swelling. If the swelling gets worse as the day goes on and improves after a night of rest, it could be related to heart failure. This happens because when you lie down, the fluid redistributes and is more easily reabsorbed into the bloodstream, reducing the swelling by morning. Consider how the swelling feels. Is it soft and leaves an indentation if you press on it, called pitting edema? This type of swelling is more often associated with fluid retention due to heart issues. Pay attention to whether the swelling is accompanied by other symptoms, such as shortness of breath, fatigue, or weight gain. These can all be signs that your body is retaining fluid because your heart isn't pumping effectively. Rapid weight gain over a short period can indicate that your body is holding on to excess fluid. Another thing to watch for is if the swelling is symmetrical, affecting both legs equally. Heart-related edema typically presents this way. If the swelling is only on one side, it might be due to a different cause, such as a blood clot or an injury. Number 4. Leg pain. Leg pain can sometimes be a warning sign of heart issues, specifically peripheral artery disease, PAD. PAD occurs when the arteries that supply blood to your legs become narrowed or blocked, usually due to a buildup of plaque. This reduces blood flow to your legs, leading to pain and discomfort. One key point is the nature of the pain. If you experience pain, cramping, or a tired feeling in your legs or hips while walking or climbing stairs that goes away with rest, this is called claudication. It's a classic symptom of PAD. The pain happens because your leg muscles aren't getting enough blood and oxygen during activity. Another important aspect is the location of the pain. It typically affects the calves, but it can also occur in the thighs, hips, or buttocks. Pay attention to where you feel the discomfort, as this can help identify which arteries might be affected. Check for other symptoms that might accompany the leg pain. These can include leg numbness or weakness, a feeling of coldness in your lower leg or foot, especially when compared to the other side, or sores on your toes, feet, or legs that heal slowly. These symptoms happen because of poor blood circulation, which is a hallmark of PAD. Look at your skin condition too. If you notice shiny skin on your legs, or if the hair on your legs has stopped growing, these can be signs of reduced blood flow. You might also see a change in color in your legs, such as paleness or a bluish tint, which indicates that your legs are not getting enough oxygen-rich blood. If you notice that your leg pain is interfering with your daily activities or if it wakes you up at night, it's essential to take it seriously. Don't dismiss it as just a part of aging or a minor issue. Leg pain that disrupts your normal routine is a red flag. Number 5. Palpitations. Palpitations are feelings that your heart is skipping a beat, fluttering, or beating too hard or too fast. They can be alarming, but they're not always a sign of a serious problem. However, understanding when they might indicate heart disease is crucial. First, consider how palpitations feel. They can vary widely. Some people describe them as a thumping or pounding in the chest, while others feel like their heart is racing or fluttering. These sensations can occur in your chest, throat, or neck. The duration and frequency of palpitations also matter. Occasional, brief palpitations are usually less concerning, especially if they happen infrequently. However, if they last for a longer period or happen frequently, it's worth getting checked out. Persistent palpitations can be a sign of arrhythmia, a condition where the heart beats irregularly. It's also helpful to pay attention to your heart rate during these episodes. A normal resting heart rate for adults ranges from 60 to 100 beats per minute. If your heart rate suddenly jumps outside this range without a clear reason, like exercise or anxiety, it could be a sign of a heart issue. Remember, dehydration can also trigger palpitations. When you're dehydrated, the balance of electrolytes in your body can be disrupted, affecting your heart's rhythm. Ensuring you're properly hydrated can help prevent this. In some cases, palpitations can occur due to structural heart problems, such as cardiomyopathy or heart valve issues. These conditions can affect how your heart beats and lead to irregular rhythms. Number 6. Jaw or arm pain. Jaw or arm pain can be a subtle but significant sign of heart disease, particularly when it's related to angina or a heart attack. Angina is chest pain caused by reduced blood flow to the heart, and it can sometimes manifest as pain in other areas like the jaw or arm. First, let's talk about the nature of the pain. Jaw or arm pain related to heart disease is often described as a discomfort or aching rather than a sharp pain. It might feel like pressure, squeezing, or a dull ache. This pain can occur suddenly or develop gradually over time. The location of the pain is crucial. For jaw pain, it typically affects the lower jaw on one or both sides. It can also radiate from the chest to the jaw. For arm pain, it's usually felt in the left arm, but it can also occur in the right arm or both arms simultaneously. The pain can travel from the chest to the shoulder and down the arm. Consider the circumstances under which the pain occurs. If jaw or arm pain happens during physical exertion or stress and goes away with rest, it could be a sign of angina. This pattern suggests that your heart isn't getting enough oxygen-rich blood when it needs it most, like during exercise or emotional stress. Think about lifestyle factors. Smoking, a sedentary lifestyle, poor diet, and high stress levels can all contribute to heart disease. If you have any of these risk factors, jaw or arm pain might be a sign that your heart is under strain. Another key point is to consider the type of activities that trigger the pain. If it's related to physical activity or emotional stress and improves with rest, this is characteristic of angina. On the other hand, if the pain occurs at rest and doesn't go away, it might indicate a more serious issue, like a heart attack. Keep an eye on any unusual patterns of pain. For example, if you wake up in the middle of the night with jaw or arm pain, it could be a sign of Prinzmetal's angina, which is caused by a spasm in the coronary arteries. This type of angina often occurs at rest and can be quite severe. It's also essential to consider your gender. Women might experience heart-related pain differently than men. They are more likely to have symptoms like jaw pain, back pain, or nausea in addition to chest pain. This can sometimes lead to misdiagnosis or underestimation of the risk of heart disease in women. Number 7. Fatigue. Fatigue related to heart disease is often intense and doesn't improve much with rest. It's different from regular tiredness. It's a sense of being utterly drained. This kind of fatigue can make simple tasks, like walking to the mailbox or climbing a few stairs, feel exhausting. Pay attention to when fatigue sets in. If you're feeling unusually tired after activities you used to do with ease, it might be a sign that your heart isn't pumping efficiently. Fatigue during minimal exertion or even at rest is a concerning sign. Notice if there's a significant drop in your energy levels over time. If you're needing more rest or sleep than usual but still not feeling refreshed, it's something to be concerned about. Heart disease-related fatigue isn't usually something that comes and goes. It's often constant and can get worse over time. If your fatigue doesn't seem to improve regardless of how much rest you get, it's worth getting checked out. Think about how your fatigue affects your daily activities. If it's interfering with your ability to work, exercise, or perform daily tasks, it's a sign that something might be wrong. Difficulty maintaining your usual routine because of tiredness can be a red flag for heart issues. You can consider any changes in your sleep. Heart disease can affect sleep, causing conditions like sleep apnea, which can lead to daytime fatigue. If you're waking up frequently during the night or feeling excessively sleepy during the day, it might be linked to your heart health. While fatigue can be caused by many factors such as thyroid issues, anemia, or depression, it's important not to overlook the possibility of heart disease, especially if you have other risk factors or symptoms. Track any other unusual sensations or changes in your body. For example, swelling in your legs, weight gain from fluid retention, or decreased urine output could be signs that your heart isn't working efficiently and could be linked to your fatigue. Number 8. Dizziness. Dizziness related to heart disease often feels like a sensation of spinning, unsteadiness, or feeling faint. It's not just a fleeting feeling but can be persistent or recurring, making daily activities challenging. Pay attention to when dizziness happens. If you feel dizzy during physical exertion, after standing up quickly, or even while at rest, it might be a sign of heart issues. This could indicate that your heart isn't pumping enough blood to your brain. Dizziness related to heart disease often comes with other symptoms like shortness of breath, chest pain, palpitations, or sweating. These can help pinpoint your heart as the potential cause of the dizziness. Heart-related dizziness isn't usually isolated. It can be recurring and may get worse over time. If you notice a pattern of frequent or worsening dizziness, it's a sign that you should seek medical attention. Both high and low blood pressure can cause dizziness. High blood pressure can strain your heart and blood vessels, while low blood pressure can result in inadequate blood flow to your brain. Monitoring your blood pressure can help identify if it's related to your dizziness. Some medications can cause dizziness as a side effect. If you're on medication for high blood pressure, heart disease, or other conditions, talk to your doctor about any dizziness you experience. They can help determine if it's related to your medication or an underlying issue. You can also check out my other video that talks about 7 signs your body needs magnesium. Did you find this video helpful? Please consider liking and subscribing to our channel for additional informative content. We appreciate your support very much.